Good morning. My name is Dr. Evan Bloom. I am the acting health officer here in Lake County, and I wanted to give you an update about our COVID response here in Lake County. So I first wanted to start with a brief overview, again, to talk about our cases, the tier that we're in, and our vaccination coverage or specifics about vaccination. And then I'll have our fantastic epidemiologist, Sarah, talk about our current data and really get down to the gritty numbers. And then I'll talk a little bit more in detail about some of the areas of note. And then you should be up to date for this week. So let's dive into it. Let's talk about our cases first. So our cases are actually doing really well. I'm very happy where we are, particularly looking at the week of April 18th to 24th. Our cases were less than 14 cases in the county, which is great. And our daily case rate was only 2.6 per 100,000, which is also fantastic. So we are doing a great job. Credit to where credit is due. The population of Lake County has been doing fantastically. So let's keep it up with continuing to appropriately socially distance and follow the recommendations for masking when masking is appropriate. The other thing that I did want to mention is that our testing positivity is less than 2%. So again, all good things. Unfortunately, we still don't have close enough to the California average for vaccination coverage of the population in our county. We have about 48% overall of our county covered with a vaccination, and California as a state has approximately 59%. So we need to get closer to that, and that as a goal is to be within 5% of the state average. So there is some work to do there, and we'll get to that later on. As far as our tier status, we are in orange, still in orange, solidly. And I had said before that I didn't think that we were going to be able to move towards yellow, but we are. We are absolutely moving towards the yellow tier, and where our case rate is, where our absolute numbers of cases, where our testing positivity is, we actually have yellow metrics, which is fantastic. Now, remember, we need these yellow metrics for a few weeks for us to actually move into this lower restrictive status of the yellow tier. However, being a small county, there are some other things that we have to think about to be responsive to the state to move into these lower restrictive tiers. And one of those is our population coverage with vaccination, which is why I mentioned before that as a county, we're only at about 48% of our population being covered or being at least partially vaccinated, where the state is at 59%. And so we need to be within 5% of that 59% state average. So we definitely need to do some work to get there. And that is right now the main thing that's holding us back from moving into our yellow tier and moving forward with taking away those restrictions. As far as vaccination status, we certainly continue to have a surplus of vaccine. And of course, as I'm sure that you've probably already heard, the Johnson & Johnson vaccine is being given at this time. It has been approved. It is out there. It is the one vaccination solution, as opposed to the 2 shots that you have to get from the Pfizer vaccine or the Moderna vaccine. And it is currently being given. So at all the vaccination centers, you can go online to My Turn. Nothing's changed there, and you can get any of those types of vaccinations. So just wanted to reiterate that the Johnson & Johnson vaccine is being given, and that is the 1-dose vaccination. That pretty much covers what I wanted to talk about in the intro. And so I'm going to pass the ball to Sarah so she can talk about our numbers in detail. And then we can get back to talking about the various subjects in a little bit more detail to answer any questions that you may have.
Thank you, Dr. Bloom. I just have a brief update of what's happening at the state level and what we're seeing in Lake County. At the state level, we've seen testing actually increase over the last month or so. The testing rate is up and has been stable for about the last 2 weeks. With that testing increase, we've still seen a slight decrease in testing positivity. We see that here on the graph on the right. The most recent testing positivity statewide is 1.1%, the lowest that it has been since the beginning of the pandemic. A very, very promising indicator. We also continue statewide to see a decline in daily cases. Our daily case rate at the California level is about 4.2 cases per 100,000. The rate of decline, again, has slowed since March, but we continue every week to see a slight decline. And the corresponding number of deaths has declined as well, as we see fewer cases to have one of the lowest death rates, again, since the beginning of the pandemic. As Dr. Bloom said, Lake County is solidly in the orange tier. Here's the map of California's 58 counties and their tier status as of Tuesday. The state will run the metrics again tomorrow, and I expect to see a few more counties move into the yellow tier as we continue to see declining case rates, testing positivity, and increased vaccination coverage of people across the state. So the metrics that we expect to be announced tomorrow from the state for our tier assignments is for the week of April 18th through the 24th, with a daily case rate of 2.6 per 100,000 and 1.3% testing positivity. This is about half of what we reported last week. I'll note here too, since I commented on the testing rate statewide, is that Lake County for the month of April has had a fairly stable testing rate at about 250 per 100,000. That is significantly lower than the state, but we've also had a lower testing rate throughout the pandemic than the state. And it's nice to see that at least it's been stable over the last month or so, again at about 250 per 100,000. So as of this morning, we've identified 16 new cases in the last 7 days, bringing the all-time total to over 3,400 cases. The epi curve is shown here. Again, want to highlight the number of new cases for the week of April 18th to the 24th was under 14. When I ran these data yesterday, 12 cases had been identified in that period. And if you look back over the course of pandemic, this is the best, this is the fewest number of cases identified in Lake County since June, a really promising sign. And as of yesterday, 6 cases had been identified for the week of April 25th. Switching gears to understand sort of the third metric that's really guiding the state and the county response is vaccination coverage. So about 71% of eligible people, again, that's people 16 years of age and older, living in quartile 4, which is defined as communities with some of the most healthy community conditions, are at least partially vaccinated, compared to about 47% of people in quartile 2, where there are some of the least healthy community conditions. I bring this up because this has guided the state's response, trying to allocate and administer as many doses in communities with the least healthy conditions and the highest case rates to reduce community transmission. I'll note here that the state is paying close attention to communities in quartile 1 and 2, where the vaccination coverage has not kept up with the pace as we're seeing in quartile 4. In Lake County, over 25,000 people are now at least partially vaccinated. This is over 48% of residents who are eligible for the vaccine at the moment. And that's about 12% of people who are partially vaccinated. 37% of people are fully vaccinated. And we still have 52% of the eligible population, 16 years in age and older, that are unvaccinated. So I'm going to transition to take a closer look at vaccine coverage by geography, by race, ethnicity, and by age group. So what we're seeing and we've shared this previously, is that people living in zip codes in quartile 1 listed here, about 37% of people are at least partially vaccinated, and people living in these zip codes here on the right in quartile 2, nearly half are at least partially vaccinated. Over the last week, we saw about 1 percentage point increase in coverage in both quartile 1 and in quartile 2. Here we're reporting on vaccination progress by race ethnicity. I'll highlight here that about 40% of Latinos are at least partially vaccinated in the county, and about 46% of white residents are at least partially vaccinated. A few reminders with these data. Initially, there was some missing data by race ethnicity collected by the state, so we believe these to be underestimates for all racial ethnic groups to a small degree. And we know that doses administered by tribal health are not included in these data reported through the California Immunization Registry. So also believe it's an even more significant underestimate of the number of Native Americans in the county who are at least partially vaccinating. And that, of course, affects other racial ethnic groups as well, because tribal health is vaccinating people regardless of their racial or ethnic identity. And then lastly, wanted to highlight progress by age group and make a couple notes here. 58% of people over the age of 65 in Lake County are at least partially vaccinated. It's exciting that nearly 50% are fully vaccinated and protected from COVID infection. But what I want to note here is that we're not seeing, this number hasn't moved much in the last couple of weeks. So we still have about 42% of people over the age of 65 who are more vulnerable to severe outcomes, hospitalization, and death unvaccinated. So I think this is an important population for the whole county to consider. And then additionally, want to highlight that there has been progress in this 50 to 64-year-old age group. 59% are at least partially vaccinated. And then 30% of people 18 to 49 are at least partially vaccinated. And as of yesterday, 5% of people 16 and 17 were at least partially vaccinated. If you're interested in tracking these data, a reminder, they're available on the covid19.ca.gov website under vaccination progress. And these data are typically updated every week, and we're monitoring them on a near daily basis. That's all I have. Thank you.
Thank you, Sarah. That was actually quite informative. And as you can see, again, we're doing quite well with our testing positivity of 1.3%, with the state positivity average at 1.1%. As Sarah mentioned, that 18th to 24th week with less than 14 cases in the county, and then another 6 upcoming. And we'll see how this week does. But again, remaining towards the lower side, and thank goodness, because we saw that plateau before a couple of weeks ago, and I was a little bit concerned that it may start coming back upwards, but we've remained low, and actually our cases have continued to slightly decrease. Our case rate is 2.6 per 100,000 as opposed to the state's rate, which is 4.2 per 100,000. And I did want to mention that the vaccination breakthrough cases, which are really just cases after vaccination, there have been a couple, but they have been either asymptomatic or only minimally symptomatic cases. Currently, I know of no cases after vaccination where someone required hospitalization. So again, another reason for the vaccination. We know with any vaccination that you may still suffer illness after you are vaccinated, but that the vaccination provides excellent protection, and that if you are unfortunate enough to contract a disease for which you have been previously vaccinated, that oftentimes the severity is much less, or you might not even notice it. But certainly the case numbers are extraordinarily low where this happens. It is a rare event. tier status, again, we are still in the orange tier, to drive that home. And our numbers are actually in the yellow tier, except for that vaccination percentage coverage of the county, meaning that 48% of Lake County is vaccinated, and we need to be within 5% of the state average numbers of those being vaccinated per county, which is 59%. So this is certainly a hurdle that we have in front of us. This is work to do, but we can do it. I am confident that we can do it. The largest population body in the county that has quite a bit of room to run in this area is our 18 to 49-year-olds. That group is only 30% vaccinated. So please, if you are in that group and you are considering getting vaccinated, or if you have been putting it off, go to myturn.gov and sign up for vaccination, as every vaccination within this group or any other age group, but particularly important is this age group because there is such a large population, approximately 70% who have not been vaccinated within this age group, is very important. So please go get vaccinated. Remember that vaccination teaches your body how to respond to the COVID-19 virus. When you get the vaccination does not stay in your body. It's in your body only for a short period of time to teach your immune system naturally how to respond to this virus, and then it's gone. And then your body can recognize the virus if you are unfortunate enough to breathe it in, and it can defend itself against this virus. And that is defense for you. That is defense against all of the prolonged symptoms that people seem to get from COVID, that unfortunately contract COVID. That is to protect you from death, and that is to protect those of our county who are more vulnerable for death against contracting this disease. As Sarah had mentioned, there is still approximately 40% of our county in that 65 plus age group that remains to be vaccinated. So by getting this, even if you're in a younger age group, you will be protecting them because you will not allow a pool for this virus to continue to grow and to spread. So please go to myturn.gov to sign up for vaccination. Back to the tiers very quickly. I just wanted to also mention that June 15th is still our date for when the tiers disappear. And at that time, the state will be giving general common sense recommendations moving forward in that tier system, which we've been dealing with for the past year, will go away. But until that point, you'll still hear us talking about our red and orange and yellow tiers. So let's strive to get to that yellow tier before that June 15th point. A little bit about the vaccine rollout. So again, vaccination is open to all of those 16 years of age and older. So if you fit into that category, you can go to MyTurn and sign up for a vaccination. If you heard, just recently, it was announced that most likely next week, the FDA will be approving the Pfizer vaccine for dosing in those of 12 years of age and older. So that is certainly to come. So expect us to talk about this more in the near future, and expect it to be available for those of 12 years of age and older in the next couple of weeks at our vaccination sites. Now, moving on to vaccination sites, I want to remind you that there are many vaccination sites throughout the county where you can go to get the vaccination. The Safeways throughout the county, various pharmacies throughout the county. Now, our OptumServe sites, which were our testing sites throughout the county, there's one in Lakeport, there's another in Lower Lake, will be offering the vaccinations for COVID-19. A note about the Department of Public Health mass vaccination sites, which are the drive-through sites that I'm sure many people have been to. These sites are in the slow but sure process of shutting down. So we are still giving second doses at these sites. And slowly throughout May, there will be fewer and fewer and fewer vaccinations taking place at these sites, with the goal still to have these sites closed by the end of May. This does not mean that you will be limited in getting your vaccination. Absolutely not. There are plenty of sites, as I just mentioned, and really the Department of Public Health sites were stood up so that you can get your vaccination, while all of these other sites were being stood up to allow you in the future, over the long term, to access the vaccination. And now that we are there, these sites can actually be demobilized. And so this plan is just being carried through as it has always been planned. And you will have plenty of locations to get your vaccination, even through your healthcare provider, as it should be, through either Adventist or Sutter. Both are providing vaccinations. So if you want a vaccination and you don't want to go through my turn, particularly to get it at a pharmacy or at Safeway, contact your regular healthcare provider or your physician, and you can get your vaccination there. Speaking of which, I would be remiss if I did not discuss vaccine hesitancy again. So vaccine hesitancy is a real thing. There are many questions out there about the vaccine, which is safe and effective. However, if you have these questions and you would like to talk to somebody, your healthcare provider will be very happy to talk to you. Please contact your provider. Again, doesn't matter where you are, doesn't matter what system you're in, contact your trusted provider with your questions and have a frank discussion about the vaccine, because it is important for our population. It is important for our social welfare to get back to where we used to be before COVID-19 came around. I won't harp on that anymore, but if you do have questions, your healthcare provider is more than happy to talk with you in an intelligent, safe conversation about the vaccine. And I believe that that is about all that I have to say for now. So in conclusion, our cases continue to be low, which is fantastic. Our metrics continue to be fantastic, which is great. So keep it up, Lake County. And we are solidly in the orange tier, with the yellow tier within reach, except that we need a greater percentage of our Lake County population to be vaccinated. Again, Lake County has approximately 48% of its population at least partially vaccinated, and California has approximately 59% of its population partially vaccinated. So we need to be within 5% of that 59% number to move into the yellow tier. Please get vaccinated. On June 15th, the tiers go away, as I mentioned, and common sense recommendations will be in place at that time. So there's more to come from the state about that. And lastly, again, that reminder that 16 years of age or older are all eligible for vaccination at this time, either the Moderna shot or the Pfizer vaccination or the Johnson & Johnson vaccination. So please go and get the vaccination. And in just a couple of weeks, those 12 years of age or older are expected to be eligible as well. So we're looking forward to that, as again, that is a large population of our county that is important to protect everyone else in our county. So we'll have more news about that coming. That is about it. And I appreciate the time to speak with you about COVID-19 this morning and our progress in Lake County. And I look forward to again speaking with you about this in the future.